Let's talk more about that speed and urgency piece because for somebody that finds this interview, maybe they were just diagnosed with cancer and they're getting pressure from their doctor to, pick a path and jump on, say, chemotherapy or a different conventional treatment. What would you say to them if it's a family member and they're just diagnosed? And again, I always like to caveat this. There's a lot of nuance. Obviously, it depends on the stage and what kind of cancer. But I think a lot of times people just feel an immense amount of pressure when they get that diagnosis and stress, and maybe they don't make the best decision under that pressure. So what would you say to them?
Number one, cancer did not happen overnight. So it is very likely that you have time to take a step back and to think about what your options are, to get a second opinion, to, read some books if you want. But unless you are in a critical state, you have a brain tumor that's squishing your brain stem, well, obviously that's an emergency. You have a colon cancer that has obstructed your GI tract. Yes, that's an emergency. So there certainly are some emergencies where you need to act immediately. But most cancer diagnoses are not an emergency. Some might be an urgency, right? That stage 4 cachectic patient, we really need to kind of get things moving. But it doesn't mean you have to jump into treatment. It just means you need to jump into activism. You need to do something now. Let's work on what that is. But somebody I see this, it's the MO, because conventional therapy doesn't think there's anything out there except for conventional therapy. There's nothing. You can't heal yourself. That's not possible. And your other alternative therapies will just see you later with worse disease. And they only see the ones that come back with worse disease, but they don't see the ones who healed themselves and went off on their merry lives. So we don't always see both sides of the story. And so I think that there is an urgency from the conventional world that this is only going to get worse. So we want to take care of it at its earliest stages where we have the most tools in the toolbox to use. But I usually tell patients that I'm working with, let's, take a step back, take a breath. Like, where are we? What are your goals? What do you want to do? Some do want to do some healing first. Others, it is the fight or flight. Their fight is to go and start conventional therapy right away. We'll do whatever you want to do, but I'm doing this tomorrow. Okay, let's do it. Let's just support you through whatever choices it is that you're going to make. But I try to help patients gauge like where they are in the spectrum, because I think that when you hear the word cancer, you think, I'm going to die, and that could be, couldn't be further from the truth. Like, most patients are going to do quite well and have many, many years. And let's see what we can do to optimize that. But again, I do try to give patients a little idea of their degree of urgency and what they want to do. And do they want to get a second opinion? Do they want to, again, what do they look like under the hood? Because some people do look pretty good already. Why did they get this cancer? Do we, think of a certain stressful life event that maybe tipped the balance, or some other injury or infection or something that, again, tipped the balance? And so what can we do? But I work with patients that come from every walk of life and every mindset. And I do have plenty of patients that are, there is some value to our conventional medicine system. So we don't want to just throw the baby out with the bathwater. We just want to say, what can we do to optimize it? What can we do to optimize ourselves? What things do we have to do? And what things, do we not have? And I never say anything is a have to. That's always a patient decision. But I'm always trying to go through pros and cons of, all of their choices so that they get it's an educated decision. And I get really kind of bothered by, documentation or statements by conventional medicine doctors that say, oh, the patient will benefit from X, because studies have shown a 50% benefit. And I'm like, well, then that patient only has a 50% chance of benefiting from that. That's not a will benefit. That's you might want to consider it. That's a really big benefit. But if it's a 3% benefit, like, why are we not having these conversations of what do those numbers really mean for the individual patient? And that's what I try to break down for them a little bit more as to, this is you personally have a 1%, 3%, 50% chance of benefiting from that treatment. So are the side effects or the risks that go along with that worth it to you? And let's figure out, if they are, what are we going to do to optimize you?
One of my favorite Quicksilver Scientific products is their liposomal vitamin C. It's great for immune support, collagen production, and antioxidant protection. The liposome is a great delivery system for effectively getting the vitamin C into your body. Save 15% by clicking the link in the description, and now back to the show. You talked about stress there, and this ties into getting the diagnosis and thinking I'm going to die. I can only imagine what kind of stress that would be to get a diagnosis like that. I'm sure only somebody that's been through it can relate to what that's like. But what I want to get into here is the stress piece, and especially getting a diagnosis like that in and of itself is going to cause a major stress to the person and their routine and their sleep. And you could see how this would just compound, and feeling the pressure to begin treatment and how am I going to pay for everything? And I'm probably not even thinking of half of it. There's so many different things I'm sure that come up, and so much stress that I can imagine a big part of your role is to help people with that. So talk about the impact of stress when it comes to cancer, and how somebody who has just been diagnosed and stress is through the roof, how they can go about managing that, we'll say.
Well, number one, I do find that patients who are most metabolically broken tend to get the most stress with they just don't have that regulation. So that cortisol really jumps up, the glucose and insulin really jump up. That being said, what I try to do is reframe the issue, right? So they hear cancer, I need surgery, chemo, I'm going to die. I hear your body has been screaming at you that something has been broken, and somehow you just haven't listened over the course of the years. Like, you didn't know to listen. This is your 2-year-old throwing a temper tantrum, but instead of just kicking him out of the house, you need to get down on your hands and knees and say, tell me, what are you trying to tell me? Like, what is wrong? What is not right in the system? So I always say this is just your check engine light going on. This is your body saying, hey, I finally had to throw down this really big, scary word at you so that you would stop and listen, so that you would stop and look. And so now let's just work to see what is out of whack and what can we do to help you bring balance back. And then do we get you into a position where either you now have something to control. I think one of the biggest stressors of getting a cancer diagnosis is you no longer feel in control. And I think that many patients walk into their oncologist and say, what can I do? They want something that they can hold on to, that they can control, that they can start participating. And unfortunately, so many times they hear nothing. Just go ahead and live your life. Don't worry about it. So I think that giving people control is a huge motivator and a huge stress reduction piece, because they finally can put those energies into positive and not into the negative.
For somebody with a new cancer diagnosis, again, wanting to take control and do what they can, I can imagine this ties into the stress. What would add to that stress is to start Googling online and learning more about cancer or their diagnosis. What I'm getting at here, is there any good resources, whether it be books or websites, that somebody who has been diagnosed can go and check out? And I know you have a new course that we're going to link up below with Dr. Westman that's all about nutrition and cancer, which is phenomenal. I went through the whole course and it's great. But what other resources for somebody that feels like they have a lot of time on their hands in relation to what they can do to help control cancer, what would you tell them?
So there's a couple of great books if they just want to be kind of more educated on the process of cancer, like Dr. Fung's The Cancer Code is a nice one. Travis Christofferson's, what is it? Tripping Over the Truth, looking at the metabolism piece. Dr. Seyfried's book is a textbook, and most lay people probably won't get as much out of that one, although I have a number of patients who say they have it and they've read it. But the one that I really recommend to people is Dr. Nasha Winter's The Metabolic Approach to Cancer. I think that is a really nice overview. Now, she calls them her 10 terrains. She has different, what she calls buckets, which would be stress and environmental toxins. And you can go through hormonal, etc. But really the foundation of the whole process is still mitochondrial health and ketogenic diets. Because if we optimize that, we're balancing hormones. We're decreasing stress. We're like people all of a sudden start sleeping better. They actually start to want to move and do exercise. So I feel like it just is like the basis. And so it's a very nice book because I think it's comprehensive, not only of diet, but of all of those other pieces that really do seem to improve when we get that basis down. So that's usually my one go-to. But yes, anybody that wants to, hopefully the course will be ultimately, we just finished the first launch of the course. They will be putting it up where we'll be able to get new folks enrolled in the course going forward. So folks would just need to join the wait list for that. But that is a nice, relatively quick. It is 4 hours or so of modules, lessons and modules, and then 3 hours of question and answer period. So it is 7 hours of content that really tries to address the why, in the prevention and the treatment, as well as the how, and then tries to do the myths, because I think that's where we get into trouble when we get to Googling cancer, and there's so much out there, and so much of it is actually myth. And I'm always trying to say, where's the level of the science before we jump into something? And we have to ask ourselves questions too. What population was being studied? How were they being studied? Were they following ketogenic diets or not following ketogenic diets? And what we might define as a ketogenic diet, because if you see in the lay press, often we'll see some negative report on a high fat diet. And then they'll put kind of in quotations, like a ketogenic diet. And then you look at it and it is not anywhere close to a ketogenic diet. It's just a high fat, high carb diet, which is terrible for absolutely everybody on the planet. So, I think that I tried to, I try in my own practice constantly to address some of these myths that are out there. And I do try to come back to science. What do we really know? Where are the gaps in our knowledge, so that I can't say emphatically, you need to do this, you have to hit this number, you need to do this. I don't do that. I say, this is what I know, and this is what I don't know. So let's just work to get us both moving in the directions that we're comfortable with, that appear to be helping you and not harming you.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
We tend to get more insulin resistant as we age. And sadly, in our today's population, everything seems to be starting earlier and earlier. So what used to be a postmenopausal disease is now...